Welcome! Today, we're diving into a medical mystery that's basically flipping our entire understanding of stroke risk on its head. For decades, we thought we knew exactly what to look for, but it turns out there's a hidden trigger, a secret culprit that could change everything about how we prevent this.
So let's get right into it. For as long as we can remember, the thinking about stroke risk has been pretty simple. The more clogged up an artery in your neck gets, the higher your risk. And that seems to make a ton of sense, right? A bigger clog means less blood flow. But what if that simple logic is actually wrong? What if the size of the blockage isn't the real danger at all?
You see, for years, this was treated like a basic plumbing problem. You've got a pipe that's slowly getting gunked up, until eventually the flow to the brain gets choked off. But it turns out, the real story for most strokes is way more dramatic. It's not a slow squeeze. No, it's a sudden explosion. It's a plaque that literally ruptures, like a tiny volcano inside your artery, launching a clot straight for the brain.
Okay, so this is where the real mystery kicks in. If it's not just about how blocked the artery is, then how do you explain this? Why are some seemingly minor plaques so incredibly deadly, while some really severe blockages just sit there harmlessly for years? And that massive difference, well, that's our big clue. Get this, even among patients who have severe blockages, the risk of a stroke in a given year can swing from a terrifying 10% all the way down to less than 1%. A range that wide tells you we're missing something huge. Clearly, just measuring the size of the clog isn't giving us the full picture. So what's the missing piece?
Well, this investigation leads us to the real culprit. It's not about how big the plaque is. It's about what it's made of, how stable it is. What we're actually hunting for is what's called an unstable or vulnerable plaque.
And this table, wow, it really lays it all out for us. On the left, you've got your stable plaque. Think of it like a hardened old scar. It's fibrous, it's got a nice thick cap holding it all together. It's calcified and hard. It even looks bright on an ultrasound. But then, look at the right side. The unstable plaque is its total opposite. It's got this soft, mushy, lipid-rich core, a thin, fragile cap that's ready to tear, and it's absolutely packed with inflammatory cells. On an ultrasound, it shows up as a dark spot, a huge warning sign.
So let's actually go a little deeper and dissect this ticking bomb. What are the specific features that make one of these unstable plaques so incredibly dangerous?
Every single one of these is a major red flag. That thin cap, that's probably the most critical part. It's the only thing holding back all that volatile gunk from spilling into your bloodstream. Then you've got inflammation constantly eating away at that cap, making it weaker and weaker. And then there's this, intraplaque hemorrhage. This means bleeding inside the plaque itself, which makes it swell up fast, putting a ton of pressure on that already fragile cap.
And here it is, the moment of crisis. The cap finally gives way and tears open. That soft, fatty core, which is what we call highly thrombogenic, meaning it makes blood clot on contact, is suddenly exposed. A clot forms, almost instantly, breaks off, and gets swept away on a direct path to the brain. And that's how an embolic stroke begins. So the challenge becomes pretty obvious, right? If you can't just measure how narrow the artery is, how in the world do you find these ticking time bombs before they go off? Well, the answer is advanced medical imaging.
Doctors have a whole new toolkit now to hunt for these things. It usually starts with an ultrasound where they're looking for those dark, echolucent areas we talked about. But the real game changer here is MRI. With an MRI, doctors can literally see inside the plaque. They can spot that dangerous internal bleeding. They can see if the cap is dangerously thin, and they can measure just how big that volatile core is. And the evidence from this is just stunning. Look at this chart. If an MRI spots a thin or already ruptured cap, that first bar there, it increases the risk of a future stroke by nearly 6 times. If they see bleeding inside the plaque, that second bar, the risk goes up by almost 5 times. This is the proof. These features are so much more important for predicting danger than just knowing the size of the blockage.
So what does all this mean for the future? Well, it's leading to a total revolution in how we think about preventing strokes. We're shifting away from just measuring how narrow an artery is to actually identifying how dangerous it is.
And this quote from the source material really just says it all. The old way of thinking is on its way out. The new era is all about figuring out the specific type of plaque a person has and understanding how it's behaving.
So here's the bottom line, and this is so important.
We're moving towards a future of truly personalized medicine. Just imagine, you could have a patient with only a 40% blockage, but an MRI shows that plaque is super unstable. That person might get prioritized for surgery. At the same time, someone with a 70% blockage that's shown to be hard, stable, and calcified, they might be perfectly fine just being managed with medication. It's about treating the danger, not just the size.
And all of this leaves us with this incredible forward-looking question. As these amazing imaging tools get better and more common, are we getting close to a world where we can pinpoint the exact plaques that are about to rupture? Could we one day just proactively go in and defuse these ticking bombs, preventing a stroke before it ever even has a chance to happen?